We only have an hour together, so I think we should launch in and get started, and I imagine more people will join as we go. Um, so before we begin, I just wanted to introduce myself. I'm Dr. Katharine Smart. I'm a pediatrician in Whitehorse, Yukon, and I'm also president of the Canadian Medical Association. I'm very grateful tonight to be speaking to you from the Big Island in Hawaii, which is an Indigenous space where the descendants of the original people of the Kanakawi or Native Hawaiians still live to this day. I am very grateful tonight to be joined by an incredible panel of women, and I'm going to introduce them to you. But before that, I also just wanted to pause and reflect on the events of the world and where we find ourselves right now with the war that's happening in Ukraine. I think that this has been obviously a really shocking events over the last weeks. I think we've all been impacted deeply by seeing the incredible suffering that's happening there. And I think it's reminded all of us of the ongoing conflicts in so many parts of the world. And tonight, I think, given that it's International Women's Day, we can reflect on the women of Ukraine, the terrible position they're in, the incredible bravery and courage it's taking to protect their families and their children, and the sacrifices they're making, and also the health professionals there that are continuing to try to care for their patients despite the really untenable situation. So I just want to acknowledge that. Tonight, we have a really amazing group of women to speak to you and to share some of their experience as leaders. I'm going to just tell you a little bit about each of them, and then we'll get right into the questions. So first, we have Dr. Rachel Bethune. Rachel is a PGY2 in pediatrics at the University of Manitoba, and she is the vice president of the Professional Associations of Residents and Interns of Manitoba. Rachel is passionate about creating positive learning environments and fostering leadership development in medical learners, and she's been involved in medical student and resident advocacy since the start of medical school. So welcome, Rachel, and really looking forward to you sharing your thoughts. Next, we have Dr. Sarah Funnell. She is one of the founding directors of the Center for Indigenous Health and Research and Education. She's also a board director of Indigenous Physicians Association of Canada, and she's representing that organization tonight. She's both a family doctor and an expert in public health, so she brings a wealth of clinical experience as well. Her background is she's a Anishinaabe and Tuscarora woman, and she is passionate about offering primary care services to Indigenous peoples, immigrants, and those experiencing homelessness. Dr. Joanne Liu is joining us tonight from Quebec. She's a practicing emergency physician and a veteran humanitarian aid worker. She's the former international president of Médecins Sans Frontières from 2013 to 2019. She's currently a professor at the School of Population and Global Health at McGill University, and she has a focus on pandemic preparedness and response and health emergencies. She is also a co-panelist on the Independent Panel for Pandemic Preparedness and Response, or the IPPPR. Next, we have Dr. Gigi Osler. She is the current president of the Federation of Medical Women of Canada and past president of the Canadian Medical Association. And she was the first female surgeon to access the role of CMA president in its 150-year history. She's a collaborative change maker in the medical world and is dedicated to building a world full and more positioned to pursue equity, diversity, and inclusion. Next, we have Dr. Modupe Tunde-Byass. She is the president of Black Physicians of Canada. She's an incredible advocate. She has a background in OBGYN and special interest in early pregnancy complications and maternal and fetal medicine. Dr. Tunde-Byass has received numerous awards, setting her sights on quality improvement and patient safety. Then we have Dr. Deidre Young. She is the president of the Canadian Women in Medicine Group. She is also informatics lead for the Department of Family Medicine at the University of Calgary. She's a site lead for the largest family medicine teaching clinic in Calgary, and she's made significant strides in medical leadership, inspired by a belief that women belong in places where decisions are being made. So I think you will all agree with me. We have just a fantastic group of women tonight. I'm really excited to hear from them and for them to be able to share their experiences and insights with you in terms of where they've come and where they're going as leaders in medicine. So I'm going to start with my first question. I'm going to direct it to Dr. Osler because she is one of my role models and probably one of the main reasons I'm sitting in this chair tonight. I had the opportunity to meet Gigi when she came to Whitehorse to attend our annual general meeting a year or two before it was the Yukon's turn to put forward a candidate for CMA president, and I certainly found her presence and vision inspiring, and it's one of the many things that got me interested in this opportunity. So Gigi, I'd like to ask you, so this year, the theme for International Women's Day is Break the Bias. And I'd love to hear from you what you think are some of the ways that we can break down bias and systemic barriers that women face in medicine.
Thank you, Katharine. And Katharine and I have shared that story before. And in the back of my head, I always imagine you saying to yourself, well, if she can do it, God, anybody can do it. But
it wasn't like that.
That's a great question. And I think of two things that come to mind right away. And I guess one thing, but break it into two. More women in leadership. And why is it important? More women in leadership, especially diverse leadership, is important, because I think that's where you really understand the importance of representation. And I think it's Marian Wright Edelman who said, you cannot be what you cannot see. So we need to see different leaders in different leadership positions in medicine. And I'm going to say particularly academic medicine. Break that down a little bit. And I love that quote from Dee, from Dr. Young, and I think it's Ruth Bader Ginsburg, women need to be in all the places where decisions are made. And that's important because not only do we need to be there, it speaks to being in those positions and those places of power. Not only do we need to be there, we need to participate in the decision-making process, and we need to be some of those decision makers.
Thank you, Gigi. I think those incredible reflections and so true, so true. I'm going to now move to Modupe and please ask your thoughts on what Gigi has to say in your own experiences.
Yeah, I think Gigi has actually started by saying one of the most important things. But for me, as a surgeon, I always think that we need to first acknowledge that there is a problem, because people don't think there's a problem about gender inequity. And there's so much stereotypes out there that we need to first break those stereotypes. People believe that women should not even be in leadership. And if they are in leadership, they're not competent. So how can that be? So that is the story that we first need to change, that when women are in leadership, we know that there's a lot of things that they do, improve patients' care, and women are able to multitask. So how can they not be good in leadership? So that is one of the things that baffles me. And I can tell you that with all the women here that I have worked with, I think this is probably even a tiny portion of the number of women that we have in leadership. The other thing that also came to my mind is that when there is no fair recruitment, how are we going to get women up there? So recruitment has to be intentional. Intentional in the sense that who brings the best to the table? And that's us women. And every organization should be held accountable and should have a dashboard. You don't even need to talk, you just need to Google the name and look, is this a progressive organization or not? Is this where I want to be? So if there are no comparable number of women that matches the number of men, with the diversity that Gigi spoke about, that organization needs to be held accountable. And for my young physicians like myself, you need a good mentor, like Katharine talked about Gigi. You need coach, and you need to enroll in leadership training very early in your career, because that's going to make you be even better at the game. So I'm going to pause for a moment there. Thank you.
Thank you for that. I love that idea of a dashboard and just that transparency, right? Where it's just there for people to see and we can actually be measuring our progress, right? Because it is hard to change things if you don't know what's going on. And also really echo your thoughts about mentorship and the importance of that. And I think as Gigi was also saying, it's having people in those spaces that other younger women can look to and see that leadership and those opportunities. And I think so often in medicine, when we're in our training, we're so focused on clinical excellence balance that we sometimes lose sight of these other skills that are really important in terms of changing the playing field. So thank you both for those reflections. I'm going to now put Dr. Liu on the hot seat and ask you, you have a lot of experience with pandemics and working in a variety of health systems. And I'm curious to hear from you as we look to rebuild our health system in what we're hoping to be a post-pandemic world, although I think we're still too early to say if we're through. What are some of the considerations we should apply to increasingly growing a female and more diverse workforce?
Oh, that's a wide question. But I think what I would like to say on this topic is we're still in the thick of it, like it or not. But B, I think that one of the blind spot that we've been having is how much women have been impacted by the pandemic and massively impacted in a much more, I would say, brutal way. And when you look across the world, is women have been impacted because they are the carer. So they're caring for the infected. They get it, but they are as well caring for patients because most of the medical workforce in terms of nursing are women across the globe. And as well, they are impacted because they are the one who carry most of what we call the informal type of work in low and middle income country, like working, in a market and selling a few vegetables. And when they were the lockdown, then they were the one who could not go and sell their vegetables. And they were so hugely impacted. So this is one thing that needs to be acknowledged about the pandemic, as I was thinking about, the after or the tail end of it is to make sure that we are going to have, like I would say, a focused attention on the disproportional impact on women. And on that as well, I think in terms of mental health, and then we've seen it in all the studies are so markedly important, is like pre-COVID-19, the burnout, I would say, level were about 20 to 40% when you were basically doing survey, as much, in Canada as in the US or in Northern Europe, and as well in Asia, everywhere across the board, it was about 20 to 40%. And then during the pandemic, the burnout level went up to 60% and above. But one of the striking, I would say, study, and I would quote one that was coming from Vancouver, was the fact that we've noticed that the people who were more at risk of it were women from visible minority in the first 5 years of practice. And so my plea to us as we are rebuilding or thinking of rebuilding healthcare system is, as women, we need to commit and promise ourselves that we're going to stick together. And when we get, on those top around the table and dealing for better, we're going to, be this sort of bonding female, I would say, agreement that we're going to stick together. Male does it all the time. And I don't know why we forget about that. That should be a given. I should walk into a room. If there's only one woman, she should be my ally. And she should be, scoring in the same goalie as me. And that is what, one thing we should promise ourselves. From now on, 2022, we in together.
I love that thought, and I've seen so many amazing quotes just about that power of feeling connected to each other and find those friends who would say your name in a room even if you weren't there and would have your back and hold you up. And I think that is so true. And also, as you said, just remembering how so often women are disproportionately impacted, whether it's in the home or as professionals. And I absolutely agree with you. I think we've seen that through the pandemic. And the data that we're seeing from our National Physicians Health Survey also shows that women are more burnt out than men from our 2021 data. Almost 60% of women were experiencing burnout compared to about 43% of men. And we also know in our harassment data, it's much more common for female physicians to experience harassment as well. So there's a lot of different gendered impacts. Before I move on to Rachel, I just want to remind those of you that are listening, if you have questions for the panelists, please just put them in the chat. We would absolutely love to ask your questions. So if you just have a general question, feel free to put it in. If you want me to direct it to a specific panelist, please do that as well. Rachel, would love to hear your thoughts as well. You're I think a very exciting point in your career, kind of halfway through your residency training. I know I was saying earlier, Rachel and I have a connection in that I've known both her parents and had the opportunity to work with them as physicians. So she's got some very amazing role models in her own family. And now she's kind of halfway through the journey as an individual physician as well. So I'd love to hear from you. You've been through this pandemic now as a resident. Where do you see we're going? And what should we be doing to make the workplace better for women?
Thank you so much. And I just wanted to say that it's incredibly inspiring to be included on this panel. So thank you all. And I just want to say thank you for the work that you've already been doing in this space, because my experience as a resident now as a woman in leadership is very different, I think, than a lot of the women that are on this panel or on this call. And it really shows, because I've had a much easier time accessing positions of leadership. And I've had the benefit of growing up, knowing that women can be fantastic physicians and there's less barriers for us to access those spaces. But I will say that there's still a lot of work to be done, especially at the intersection of race and gender and disability and sexual orientation in women, whether that be in the resident space or in the workplace or beyond. And so I'm going to focus a little bit of what my experiences is on residents, because I am still halfway through my training. And so I think the pandemic has been really challenging because it has impacted how much stress there is and how sometimes that can come down upon women in medicine or residents in medicine, and we still have to pick up the burdens in our home or with our families. And so I think going forward and moving out of this pandemic, we can take some of the lessons we've seen in being flexible and doing remote learning or doing virtual learning, or being able to be flexible in terms of childcare, and we can bring that forward so to try to decrease the burnout that residents are feeling. And I think we can lift each other up in that way. And in my experience in leadership, I think what really resonated with me is having access to mentors who can raise the voice of residents and who can say, that was a really good point. I'm going to bring that forward to the positions of power, and why don't you come join us at the table? And so I think moving forward out of the pandemic, being able to have residents and medical learners, including medical students, at these tables, because we are impacted by the policies and the challenges in the healthcare system in unique ways. And so being able to have us at the table to say, have you thought about it this way? And then lift our voices up is really important. And I have been the benefit of that. And so I just wanted to say thank you to all of those who are in the position now being able to lift up resident voices, because it truly does make a huge impact on the educational experience and the leadership experience that we can have as women.
Great, thank you for sharing those reflections. And I certainly always say I love working with residents just because you bring so many different perspectives and sometimes different ways of seeing things that I haven't always considered, and I'm sure the other panelists feel the same way. So I think that learning is often very bi-directional, and you all have a lot to share with us too, with your experiences and just your lens on what's going on. So thanks for sharing that. Next, I'm going to move to Deidre, and I'd like to ask you, you are part of this incredible organization, Canadian Women in Medicine, that has a really significant Facebook presence, as well as offers an annual conference every year that I know has been very well attended, and women have appreciated that Facebook space, I think, just to share their experiences and to reach out for things we've been hearing about tonight, right? That support, mentorship, sometimes, solutions to complex problems, or even just to be able to vent a bit about what's going on in a space with people that have the same lived experiences. So I'd love to hear from you about what some of the initiatives CWIM's working on and how they relate to the conversation we're having today. And this is an opportunity, I think, for you to talk to some of the women in the group and ask them why they should, or maybe encourage them why they should join your organization.
Get the plug in. Well, I'm going to start with a plug. And the first plug is one of the things that we're doing is Canadian Women Physicians Day, which is happening on Friday. And you're all invited. And it's to celebrate women and their achievements in medicine, but also to sort of look at some of the issues that are facing women in medicine. So that is coming up. Dr. Wang, I'm going to mention some women's names so that you all know them. Dr. Leanna Wang, this is her baby. And I am going to put into the chat the link for you to be able to access that coming up on Friday. Besides for that, we also we have the conference. So there's the annual wellness conference. We have leadership sort of conferences, speaker sessions, parenting, like things that are about women. So not just about in your professional life, but also in your personal life, that you have that support. The goal is support. I mean, if we're being totally honest, this started as a Facebook group. Like CWIM actually came from a Facebook group of women in medicine who were talking together and realizing that we could reach out and ask people things. And you know, the good thing about the internet, there's good, there's bad, is that I could reach Gigi in Winnipeg and say, hey, you know, here's some things that are going on with me. I saw that you were doing that. What do you think? That sort of stuff. And so we're trying to expand on that. We also are working on a mentorship program to try to bring people together. And we have some advocacy efforts that we're working on as well. And I'll plug another name, Michelle Cohen, you've probably seen, is pushes a lot of advocacy sort of things for us. So we have, I don't know, that's the sort of stuff we have going on, and you should join us because we're great. I mean, I'm going to plug us now. It's we're a great group of people who we just want to support each other. The goal, I think I see this thing all the time, you know, it's a good woman, one who adjusts your crown without telling you it was crooked. That sort of idea of just support and not feeling like, I think that there's been a long time, there's sort of been this idea that there's a fixed, like, you know, only 10 people can be in the room. And so, you know, if we have the one woman, well, then, you know, the only way that the other is if we get rid of that one woman, because obviously there should be 9 men. But I think there's the idea that, first of all, we have to say, you know what, we can have lots of women. Like maybe this room can grow and it can be lots more people, and they don't, you know, it doesn't have to be that there's this many women or this many men, but we can just keep growing. And I think that's what we're after, is sort of supporting each other to be able to do that and to see that and to see each other doing things.
Yeah, I love that. That's great. Thank you. And I would also say some of you may have read the op-ed that I was fortunate to have in the Globe and Mail today about women in medicine. And a lot of the content from there was actually inspired by discussions in the Facebook group and different challenges that women were bringing forward. So it's a great place, I think, to go and find that collaboration and that connection. Gigi, I'm going to ask you the same question because you're president of the Federation of Medical Women of Canada, which is another fantastic women's organization focused on female physicians. So please tell us a bit about your organization, what it's up to, why people should get involved.
Thank you. And if I wasn't paying attention, it was just because I was answering a question in the chat, a really good question about sort of that women on girl bullying, which I think is the queen bee phenomenon, which I know everyone here has probably all experienced. And my interpretation of it, as I was trying to type it out, is that, you know, I approach those women with understanding and empathy, because I think it is often a learned, conscious or unconscious, often unconscious survival strategy in environments that are very male dominated. And so, you know, sometimes if you can have a colleague of them or somebody close to them, help them understand how they're acting. And really, and I share what Joanne was saying, you know, these are tables and these are opportunities for women to support each other and to lift each other up. And so I would say, you know, answer to that, look at queen bee phenomenon. But the Federation, we are almost 100 years old. And what I learned about the Federation when I joined it was, and I didn't know this before, it was formed by 6 women attending the CMA annual meeting in 1924. Now, either they weren't allowed to attend or they were allowed to attend but weren't allowed to speak. But as a result of that, they decided we are going to form our own association to support the development professionally and personally of medical women, as well as to promote the health and well-being of women. So a lot of the work that we do is steeped in advocacy. A lot of the work that we do, and we've got several standing committees, one is on HPV. And you may have seen our very own Dr. Vivian Brown on the news. I was getting my toes done. I had a pedicure last week for the first time in months, and the pedicurist was shocked. But I'm sitting there and I look over to the screen and I see on my evening news, Dr. Vivian Brown talking about the importance of HPV vaccination. We also have a Women, Peace and Security Committee, which is very closely tied into the Women, Peace and Security Network of Canada, because we believe inclusive, healthy, gender equal, and peaceful societies must have women involved in all of the processes and all of the decision-making tables. So again, love for you to check us out. Our annual meetings in the fall. I'll tweet about it. I'll put it out on social media. But really, this is an opportunity, just as you're doing here, for all of these associations and organizations to work together, because we are better and stronger together.
Great. Thank you, Gigi. So I think for any women that are on the call, you've heard about two great opportunities to meet other like-minded women who care about their communities and society and each other, the Canadian Women in Medicine and the Federation of Canadian Medical Women, or Medical Women of Canada. So two great organizations to join. Next, I'm going to go to Sarah, please, if I could. We've been talking a lot about gender biases tonight. We've heard about that, but we also know that there's a lot of other biases in our health system that impact both providers and patients. And I'd love to hear from you what you think are some of the concrete actions that we should be taking to try to address those biases.
Well, miigwech, Katharine. And firstly, I just want to acknowledge that I'm here representing the Indigenous Physicians Association of Canada, because my colleague and president of the Indigenous Physicians Association is taking a much needed rest. And so when you think about having lots of women in leadership positions, we can help each other rest. And just listening to all these incredible women, it makes me think of an elder, Algonquin elder, recently told this story about how our traditional ways were, when a woman was on her moon time, when she was menstruating, women would take her to the lodge and take care of her. And so I think, how powerful is that? And gender bias is about power. It's power and control over women. And so, what can we do together to regain that power? And so a concrete action is for everyone to look at the Missing and Murdered Indigenous Women and Girls report about reclaiming power and place. I've been on a journey to learn about my power as an Indigenous woman, and I'm very grateful and thankful for other Indigenous women that have guided me, both through like who I am, what I can be, my sexuality, so much about myself that I was afraid to look at. And I belong to an informal group. We call ourselves the Medical Matriarchy, and we are there to support each other. And it's kind of like geese, when one of us gets tired, someone else takes over. And listening to all of you, it's just, reminding me of how important those really powerful Indigenous traditions are, and how we can all gain from reclaiming those. And so concrete action, take a look at the Missing and Murdered Indigenous Women and Girls report. It'll be painful for you to do so. But from that place of pain comes growth. So thanks, Katharine.
Thank you, Sarah. Thanks for sharing that. And I absolutely agree with you. There's so much that we need to learn about the history of Canada and how we need to make different decisions moving forward. And I also love that visual you gave of the geese in formation and that idea of being able to take turns, right? We don't always have to do everything ourselves. And I think that links a bit back to what Gigi, when she was answering the question about bullying, why do we sometimes see that behavior between women? And I think it does sometimes come back to not really embracing who we are as women, but embracing some of the other traits that we've maybe felt we needed to use to get to where we are in medicine. And I love this idea of coming together more as a collective. Modupe, I would like to ask you that same question. You're president of the Black Physicians of Canada. What do you see as biases in our healthcare system in addition to gender issues, and what should we be doing? What conversations should we be having?
Thank you so much, Katharine. I think that's such a great question. And I must follow what I think it was Joanne that talked about women, we need to stick together. And for everyone who is in this audience, Black Physicians of Canada was actually founded by 2 female residents. How cool is that? So Dr. El Hadi and Teresa Semalulu founded this organization. So the BPC, as you know, it's an organization particularly empowering and also supporting Black residents and trainees in their residency and also early career physicians. So when we look at gender, we also need to look at intersectionalities. We're looking at race, we're looking at ableism, we're looking at sexual orientation, we're looking at so many women. We cannot afford to be homogeneous, otherwise we're going to lose out. So we need to improve our numbers by looking at all those minority people. What does Black brilliance mean to the conversation? What would it be to have someone with hijabi in our conversation today? These are the ways that we can break barriers by including everybody. We know that racism is a health crisis and we cannot move away from it. As it affects me, it affects each and every one of us because we're women. And we know that in one way, we all connect together and we need to stick together, just like intimate partner violence that we saw in the era of COVID-19. It's so hard for women to even be away from their perpetrators. It's not as easy as putting your mask on or having social distance because you're all in the same confined area. So when we look at racism, we're looking at people who have no ability to achieve their potentials. Have we sorted out the problems of having the right number of physicians to even represent our Black populations or our BIPOC population? We're very, very far from it. So I have to give kudos to University of Toronto for having a pathway for reviewing Black medical students' application. And that has been caught on by University of Alberta, Calgary, and now UBC. In 70 years, 36 medical students, they are now going to go through that. So I think it's important that we focus on those things because it affects us, like I said, as women. The other thing I also think it's important is to hold the system accountable. Where do we want to be as an organization of women in 5 years' time? Maybe we want to increase our numbers from 30% of divisional heads. 30% of departmental heads are women, and we know we do a better job. Where do we want to be in 5 years? Maybe 60%. How do we get that? We need to bring everybody to the table, and collectively, we're going to even be stronger together. That's my message, and thank you so much for inviting me.
Well, it's a wonderful message, and I love it because it's also about action, right? Let's not just talk about these things. Let's do some concrete changes to the way our systems work to ensure we get these outcomes. So I think that's really important. I have one more question that we had coming into this panel, and then I'm going to turn to some questions we've been getting in the chat, which are fantastic. So I'm looking forward to that. But for my final question, I'd like to ask Dr. Liu. You have had amazing experiences working internationally, and you've worked in a lot of different environments. So would love to hear from you. What have you seen in those environments that might be different than what you've seen in Canada? Is there different challenges, different issues, and what are some of the things you've learned from your experience that you think could benefit us here?
Well, I think that human being. So I think that things are somehow similar. So what I would like probably to bring back as memory is those that when I was the international president for MSF, Doctors Without Borders, for 6 years I ended up attending different panel, And basically, regularly, I was the only woman. And the thing is, what ended up being happening, and maybe some of you will recognize yourself in this, is when you're a woman, and in addition, you're a visible minority or a minority, you check 2 boxes. And if you're a good speaker, you get invited everywhere. And all of a sudden, you become a token, because it's like people just say, "Oh, we invited Joanne, check mark, tick, Chinese, tick," and that's it. But the thing is, nobody, is really paying attention to you. They just give you like, they just make sure that you say something for like a couple of minutes. So what I would like to convey to the audience today is never be apologetic for being in a panel. Occupy the space fully, smile, come absolutely prepared, overly prepared, confident. And then I do wish you that the ceiling I hit would be your floor as a leader of the world. That's what I wish for you.
That's wonderful. I love that. Thank you for that thought. I'm now going to go to some of the questions from the audience so that we can try to get to those. So the first question was, and I think this is really relevant for the world we're finding ourselves in right now, is how does social media and Media 2.0 affect patient care? And how do you integrate new technology into your practice? And I think I'm going to expand on that question to ask our panelists, not only in your practice in terms of patient care, but I'd also love how you're using it for advocacy. Because one of the things I think has really been interesting throughout the pandemic is how many physicians we've seen step into that space in the media, in social media, to share information with Canadians and also to combat misinformation, which I think arguably is one of the bigger threats to health right now. So I'll maybe start with Gigi, since she's a TikTok star. Tell us a bit, Gigi, about your journey.
Thank you very much, Katharine, for the question. And I agree with you. Certainly over the last few years, I have seen more physicians on social media, on several different platforms, speaking out about the pandemic. And we are trusted voices in the community. As women on social media, there's a double-edged sword. And that speaks to a lot of the bias and harassment that women face around the world in real life situations. And so as the woman navigating that space, it has become a much different space. And I think that difference has come not just because there are different opinions in society on vaccines and mandates. I think if you were to look at, there's other different agendas out there. I do think, and this is my personal opinion, it is an important space for physicians to be on, to demonstrate our leadership, to be good communicators, and to be health advocates. And so finding, if you want to be on social media, it's not a have to be on social media, but if you want to be on social media, I do think you need to look at what are the parameters and boundaries set out by our regulatory colleges, our associations. How are we presenting ourselves? And we do not want to cross any of those parameters set out by our, particularly our regulatory authorities. I think we can think about the message that we want to bring across. And is it a message of health, advocacy, awareness? And the trick is crafting messages designed for your audience. And so I find on the different social media platforms I'm on, my audience on Twitter may be quite different from my audience on TikTok. It sounds juvenile, but I am on TikTok. But I use that platform as a health education platform. And so I think it is a good place to be. It's not a place where you want to spend all your time on, but I primarily use it for health education and advocacy.
Great, thank you. Does anyone else on the panel want to comment about their experiences with social media or media?
Oh, sorry. Sarah can go.
Wow,
Just jump in, ladies.
I kind of want to get into TikTok too. So I'll ask you, Gigi, for some advice. I'm probably not the most savvy person on social media, but in looking at uplifting other women, I use it for that. And I try to stick to just sharing love and light and not starting fights on social media. Those that know me know that, you know, my Algonquin name is Minwanamad. It means pleasant breeze. I was named by my auntie. So it's just who I am, and it feels right. And so maybe other people use it in more aggressive ways and think it's advocacy. But I'd like to say that a physician using social media, think about your responsibility. With that, your great power comes great responsibility. I'm quoting Spider-Man, but it's true. And so I think you have to just pause for a moment before you post something. Think really carefully about it, because you really are quite powerful. And I think the public has been confused over this pandemic, with different physicians expressing their opinions on social media. So just remember that that you have a great responsibility.
Yeah, thank you, Sarah, for sharing that. I absolutely agree with you. Modupe, what would you like to say?
Well, so I was just going to jump in there and say, for a physician like myself who wasn't really social media savvy, you know, I was mentored to do that by the residents who I truly respect. And they introduced me to Facebook, you know, Twitter, because during the pandemic, we know that there was a disconnect between, you know, information that our patients are going to receive, because suddenly there were no offices, we could not, you know, it took a while. So I, with a resident and another physician, co-founded this organization called Women's Health Education Made Simple, called WHAMS. And the aim was just to disseminate accurate, evidence-based information on the internet for women to access. And I think it was very important, especially when we didn't know about all the myths and the facts about COVID-19 vaccine. And it was a way to reach out to the audience and to reach out to them quickly. Even I, that wasn't comfortable, I knew that this was an avenue to reach out, and mostly women, talking about intimate partner violence, what to do, spreading the news about preeclampsia and the use of aspirin, because COVID-19 was impacting pregnant women. And we needed to reach out to them about, you know, prevention with aspirin very early in the pregnancy. And for me, I hit over 10,000. That's just me. I had no clue about, you know, social media. So I want to say that this is something powerful, and physicians should be there, because this is how we can combat disinformation, and we can help a lot of our patients being able to get the same information. But we have to be careful not to take advantage and not to spread fake news as well.
Yeah, thank you. And Dee, I think you maybe wanted to say something.
I think they all said it great. I think that I would agree with the idea of sort of amplifying those who are spreading like the good information, right? Like I'm not a tweeter per se. You know, I retweet things, but I do try to amplify others. But I've seen the bad side of this. Like one of my colleagues had, you know, she was a advocate for many things, and I'm trying to be purposely vague because she ended up like having to leave Twitter, and she had college complaints lodged against her, not based on the medical care she was providing in any way, but because people didn't like what she was saying on social media. And it can be, I think, and I think more so for women, it can be a very sort of dangerous place when you're putting your name out there, you're putting your face out there, and And there's people that don't want good information, or they don't want to hear things. And so their response to that is to be threatening or dangerous. So it's just sort of, it's a bit of a double-edged sword. That said, things like Facebook, and like I said, it can be a great way of communicating, amongst your peers, and like finding out, advice for things that you're doing and stuff like that. So there's definitely some benefits, but it's definitely, as you said, a bit of a double-edged sword.
Yeah, absolutely. And Joanne and Rachel, you've got your hand up. Let's go to you.
I will just say social media is not going away. And so being able to learn how to use it in a safe way, and that you're not spreading misinformation, or you're asking your local resident how to, share something, or being able to use it to connect with ideas and women across the country, it can be an incredibly powerful tool. And so, also to be able to take it and use it in your practice, or share technologies, or share it to do telehealth, or to be able to just use it as a tool is important. And so I think being able to, for us to look forward as women and say, how do we want to use this to lift each other up, is going to be really important. And it's interesting to see how residents have been using it and medical students have been using it, because we've been growing up in this era. And so I would say, look, there's lots of residents who are doing wonderful advocacy, either at grassroots levels in their own communities, or are spreading kind of advocacy across at a national platform. And so just, I would say, follow residents and medical students too, because they have some really interesting voices to share as well.
Thank you for that. Joanne, did you want to make any comments about media or social media?
Just a short comment. I think that and just to go back, I think, to what Gigi was saying is we trusted people in our community, and I think that it is very it's such a privilege, and I think it's important that when you say something on social media, that you make a distinction between things that you really you have some legitimacy to talk about, because it's your specialty, because it's a point of competences for you, and then you should make as well, and it should be clear as well when, if you're expressing an opinion, which is two different things as far as I'm concerned. And I do find that during this pandemic, many physicians has mixed the two together. And then somehow I've given opinion of things on which it didn't have the competency, and sometimes, they really miss. Unfortunately, it happens, and everybody, it happens. But I think if you frame, you come in and just say, that's my humble opinion, but take it, as this, it's okay. But I find that when people talk with authority, and people already are giving us authority just because of our status, we should be very, very humble by that. And we should be very, very careful. That would be my only advice, because otherwise you get yourself into some weeds that you might not want to be.
I think that's great advice. Humility and responsibility, and spreading positive things. Absolutely. I've my own reflection. I've been, much more involved in mainstream media and social media, of course, in this role than I ever have been in the past, and it's been very interesting. I think for me, the thing I've enjoyed the most is the opportunity to reach larger numbers of people, especially around advocacy. So I've obviously, as a pediatrician, a real passion for me is vaccination, and given that we're in a pandemic, not only of children but also of adults, and I've had the chance to participate in several social media type engagements where they've been focused on answering questions and presenting around vaccination, and much like other people were saying, it's kind of amazing when you realize, several hundred or thousands of people were able to listen in or hear what you're saying, and just that ability to have that broader impact, especially for people that may not have a trusted health professional in their life that they can turn to with questions, and you may be the only doctor that they see as a trusted professional that they're hearing information from. So I've really appreciated that opportunity, but absolutely echo what you were saying, Joanne, is the humility, and that needs to come with that. And what other people were saying is that we need to recognize the power of our position and take that seriously when we're doing health communication. So I think fantastic suggestions and reflections. I'm going to go to the next question, which was, how do you cope when you hit the glass ceiling? Any of our panelists want to tackle that one?
Shall I?
Please, Sarah, go for it.
Okay, well, I can't see the glass ceiling. So let me just start with that. So I'm not really sure if I've hit it, or I'm very far from it. But you know, just a personal reflection about being a public health leader in a pandemic times. I'm a mother of 3 children, 3 daughters. They're well, someone's birthday is tomorrow, so she's turning 11. So I have an 11-year-old, a 12-year-old, and a 14-year-old. And one of my children has had a significant health issue during the pandemic, and I was leading the pandemic local response. And wow, like that felt horrible, because this was supposed to be my moment as a public health physician. Pandemics don't happen all the time. But to see my child suffering, and knowing that I had to leave so I could keep her alive was really difficult. And so, you know, I saw this this advertisement for resiliency training and leadership with MAMTA. And so I'm like, oh, can I access that? Because I'm lacking in my resiliency right now. And so back to our one of our other panelists that said, you know, you need these supports like a coach, a leadership coach, mentors. At that time, it was just an incredible support to me, because it helped guide me through some difficult decisions. And I'm forever grateful for that, and had to leave my leadership role to be a mother. I don't know if that's a glass ceiling. I don't think I was quite there yet. But and honestly, now I'm farther from that glass ceiling than I was at that time. So it's difficult, and we need support.
Thank you for sharing that, Sarah. Dee?
I think that I don't know. One of the things with the glass ceiling is that part of it is being in places where you're valued, right? So you hit a glass ceiling when there's people that don't necessarily appreciate what you have to offer, or can't see for whatever reason what it is you have to offer, and aren't willing or able to help you to get to those next levels that you're after. And so I think part of it, which is like, this is one of those like easy to say things, but part of it is acknowledging that, is like looking at the situation that you're in and saying, is this a situation where this group of people that I'm with is actually ever going to see me for all that I can be? Or is this group of people seeing me as, you know, she's a great middle manager type, you know, whatever, you know what I'm sort of saying. And if you're in an environment where people don't see that for you, or don't see your capacity and what you can do, then maybe start spreading that and spreading out your wings and turning around, trying a new environment, right? And I know that's like really easy to say or whatever, but I think that sometimes we need to take a bit of a leap, and sometimes we need to expand. And this is where the great opportunity is with these peer groups and stuff like that, is go to, you know, if you're like, for example, I've been to the CWIM conference. I met Gigi Osler there. I was like, look it, I'm chatting with Gigi Osler. I took a picture with her. I'm not going to lie. It was like my little fan thing, but she like gave me confidence. Like, okay, look at her. She's doing all these things. I can do all of these things. So if I can do all these, I'm going to do all of these things. And so I did, and I changed jobs, and I went and did other things. And now I have a number of leadership positions, and I'm very proud to say that I am in an environment where my contributions are valued, and where my opinions matter, and where I'm helping to direct things. And what I hope I'm doing is helping bring other women up with me, and mentoring learners, and doing all those other things. So I'm helping to contribute to make sure that the environment that values me values other women as well.
I love that, Dee. I think that's so important, and I absolutely agree. I think we have to know which battles we think we can win, and not be afraid to pivot away from things that aren't serving us, and like you say, laying the groundwork for other people that are coming in our footsteps. Gigi.
Thank you. And Dee, I remember that from years ago. And if I look back 10 years ago, I'd applied for something and did not get it. And it was something I thought, and I still think I could be really good at. And it was an academic setting, and I didn't get it. And I was devastated. And I reached out to a close colleague of mine who said, Gigi, sometimes you are not a prophet in your own land. And I thought about that. And I realized I needed to look for a different land because I had hit that glass ceiling and it hurt. And I didn't want to feel that feeling of, I didn't want to feel sorry for myself. And so I started to look for different lands. And by that, that's probably the point in my career where I switched a little bit. And I had always thought my success was in an academic setting. But I don't do the research, I don't bring in the grants, I don't qualify in that academic rubric of what a successful academic is in a university setting. So I started to look outside of that. And so for me, it was looking for other places, other opportunities to advocate, to do the things that I was passionate about, that in that other setting were sort of poo-pooed and it was floofy, and that's just Gigi talking about wellness. And I was looking at the participants on the call and on our chat tonight, and I want to point out, and I think she's still on, Dr. Marcia Anderson. And Dr. Anderson works at the University of Manitoba, one of the fiercest, smartest, most strategic women I have ever had the pleasure to meet. And she has just been appointed into, I think, an even bigger vice dean role. And I see women like that in these settings who I know will change those rubrics and will change the expectations and will change those environments to make little holes or big holes in those glass ceilings so that future generations of physicians won't hit their heads like I did, like we've all hit our heads.
That's great. Thank you, Gigi. We are getting close to out of time, but I'm going to try to fit in one or two more questions. So the next one is for Joanne, and it was a follow-up regarding your comment about tokenism. So I'm going to read you the question here. It says, as women in leadership positions, how do you move beyond being seen as the token female/minority in the position? How do you navigate the double bind that women in leadership face, meaning the societal expectation that women are nurturing and caring, but when they speak up in an assertive way, they are seen as aggressive? I appreciate this question because it's an issue I have encountered many times myself. And I love that quote about, the reason there's so many difficult women is because of the way we're perceived. So Joanne, what are your insights on that?
Yeah, just before, I just wanted to say something just in reaction to what Gigi said. It's I think that sometimes you might think you're hitting a ceiling, and then just for you to know, I applied for being the international president in 2006 and I didn't get it. And I remember that it's an election in MSF, in Doctors Without Borders, and I remember being asked, how do you think you will impact the image of the movement, you as a president? And I just remember saying, oh my God, I'm getting that in 2006. Are you kidding me? Anyway, I didn't get voted after 6 rounds. I was like devastated. And I remember, being, basically not even able to walk in the hallway in my hospital because I just felt so much like a failure. And then at one point, later on, someone came to me. I was doing my master in leadership at McGill, and they asked me, what's your problem with that? He just said, snap out of it, move on. who are the people who got, voted first time around when they run for presidency? Well, of course, we know few names, but is there a problem? And I'm just telling you that story, that maybe it was at the right time, and you can get a second stab at it, and you might get it. And actually, I've been a much better president from 2013 to 2019 than I would have been in 2006 for many, many other reasons. So just sometimes, it's an apparent ceiling. So that's one thing. I think about the tokenisms. I think you need to embrace that. You know what? You just say, come on, give it to me. I'll be on your panel. I'm going to take it. I'll be the woman. I'll be the visible minority. And I'm going to be, and I always get very calm. I'm not aggressive. And I always, try to be firm, but and it's true that like if men, I never raise voice, for example. That is a no, don't go there. I don't raise voice. And then I do the French way, because the French has a way of being in panel, is they look at you, they smile, and they say, I really agree with you, but, and then they just disconstruct the whole argument. So the French way, guys.
Thank you for that, Joanne. I love it. Unfortunately, we're out of time, which is too bad because I think this is such a phenomenal group of women, and we had a few questions left, and I could think of a million other questions I'd love to ask all of you. But I'm just going to conclude by thanking these amazing panelists for sharing their experiences, their insight, their passion. I think they've done an incredible job of laying that foundation for the rest of us as we go through this journey together, trying to change the culture of medicine, the space of medicine, and create a better healthcare system for ourselves to work in, and of course, importantly, for the patients that we serve. I think we know that the pandemic has really stressed our system in ways we couldn't have imagined. And I think we also all know that the problems we're seeing aren't new ones, but they're much more public facing now than I think they've been before. And I think as women and as leaders, all of us in this space, and that all of you that joined tonight as panelists, or pardon me, as attendees, are really committed to wanting to see a better future for healthcare in Canada. So I thank you for your time and for joining. I also want to let you know that the CMA is going to be running a health series summit that'll be starting at the end of this month, where we're going to be having more of these types of conversations about our healthcare system, where we're headed, and you will see lots of different leaders there sharing their experiences and insights in terms of what comes next for us. So I want to thank everyone so much for joining us on International Women's Day. I want to thank all of these women who inspire me in my work, and I've been so grateful for this opportunity. And one of the best parts of being CMA president is all the other incredible leaders and just humans that you get to interact with every day. So thank you everyone so much, and I wish all of you a wonderful evening.
Thank you.